is Jessica Estévez. I am president and co-founder of Estrategia Group and have been living in the Tampa Bay region for over 10, 15 years. Really invested in building capacity for equity, leadership, and our communities. And I am here today with Galo Cruz to talk and learn a little bit more about HIV/AIDS in our community. Galo, why don't you introduce yourself, please?
Yes, my name is Galo Cruz, and I work in EPIC in St. Pete campus. I work with the medical case management with the HIV population, and my passion is to work with the Latino community, to educate and linking my client to services according to their needs.
Where are you from, Galo?
Oh yeah, born and raised in Puerto Rico. For some reason, I decided to move to the United States, in Philadelphia, Pennsylvania, and they are now living in St. Pete, Florida.
Nice. How do you like St. Petersburg?
Oh, awesome. I love it.
Yeah, what do you like about it? Tell me one thing you love.
Remind me Puerto Rico, the way I was born and raised. I used to live close to the coast, and this is the closest that I find out about Puerto Rico.
We got some beautiful beaches, don't we?
I agree with you.
Yes, yes. So you work with the HIV community in the area.
Correct.
Tell me a little bit about what your work looks like. What is a day-to-day? How are you supporting and helping clients in this area?
Yes, there are some cases like, for some reason, they send the cases to us. People without medical care, without medication, I need to complete the paperwork, the eligibility, and also to set up medical appointment with Pinellas Care Clinic, PCC, and then to help him because the language barrier to set up appointment with ADA for the medication. And also my job is to educate the Latino community about CD4 or the immune system, the virus attack the immune system, and how to control the virus is taking your medication. I always put my finger. Remember CD4 up, viral load down. If you keep taking your medication, at the beginning, the viral is high, CD4 is really low, but when you start taking your medication, CD4 is up and the viral load is...
You lost me there, Galo. So the language even on the information about HIV, is it popular? What is impacting our community getting or being impacted by the HIV pandemic or epidemic here in the area? Tell me a little about how are we doing? What are our grades? How are we faring in the HIV and the Latino community?
Yes, I consider the Latino community like a sleeping giant. And in case of HIV/AIDS, it's sad to say it, but it's painful to me to find out that, for instance, the older Latino in the United States, the fourth cause of death is HIV. Among younger Latino, it's number 6. And my job is to educate the community the importance of taking the medication or be connected to services.
Yes. So how and why are Latinos becoming infected or becoming, is that the right word? Do I say infected, impacted? How do we say that?
Look, some more fancy impacted, but in reality, one of the reasons is the lack of education. For instance, they can go to the doctor, especially in this area, I don't see so many bilingual staff. When they start talking about clinical terms, they get lost. And this is one of the reasons. Also, afraid to the cost. Some people are afraid that if I go to the hospital, I might be deported to my country, and they refuse to go or seek medical attention until they are late when they find out is diagnosed with AIDS.
Mm-hmm. So if I'm hearing you correctly, education, the lack of income or access to services, and also the fear of security is impacting how much folks are getting support or even being diagnosed around HIV. Is that correct?
Correct. There are some cases like, I used to have a case like they coming from the hospital because the person came from different country, and for some reason she stopped taking the medication and ended up in the hospital. It touched me because one of them, if you look in the past, in the 1980s, the majority of the cases, it was in up northeast. But because the weather, the nice weather, sunny, people start moving to south. And what happened? They want to move to south because the weather, with better condition. But when they move, sometimes they came without medication. They left the proof of status or proof of HIV. And when they move to Florida, for instance, the process could take maybe 2 to 3 weeks to start treatment, and they're gonna be delayed. It has been proved that after 1 week without taking the medication, HIV the virus became detectable, and they might propensed to having high risk behavior in that part.
So if I think about our community, they are the folks who are not yet infected or impacted by HIV, but are at risk. Who are these people?
Put it this way, the HIV is not like a bird that's moving around. The HIV is with you, and whatever area you go, the HIV go with you. And what I said, with the lack of health insurance or lack of education, and people are willing to take or having sex without taking medication, and this might be a risk in the high crime population.
But so there's folks who don't even know that they have HIV, and like you said, they have it with them, and they're engaging in sex. So how do we address these folks that don't even know they have HIV and are interacting in ways that are not safe? How is that coming across?
I think education is the key part. I compare the HIV/AIDS like a watermelon. One color outside and inside a different color. People get surprised when I try to teach my Latino community that HIV to turn AIDS might take between 5 to 10 years to change to HIV to AIDS. That's why so many Latinos ended up with late diagnosis, because they don't know, they're feeling okay, they don't know the symptoms, and when they open their eyes, they ended up in the hospital or being too late. Because if your immune system is too low, they open the door to different disease that can attack. You're only dealing with HIV, now you're dealing with different opportunistic infection or another disease. Because the immune system is like an army. When something came out, the system got the alert and they start fighting. But when you got low immune system, it's less propense to come.
So this sounds like an area where it'd be helpful to clarify. What is the difference between HIV and AIDS? And how do you explain that in the Latino community in a way that they understand? Is a little bit of what I'm hearing you do.
Yes, the difference between HIV and AIDS, sadly, but it's true, is the number. If your CD4 or CD4 count is below 200, it's considered AIDS, because your immune system is weak. And because your immune system is weak, people can have different disease than normal people can. And if you are HIV positive, for instance, you viral low, or your CD4 count is over 300, it's not considered AIDS. But if the CD count is below 200, even though one time, it's considered AIDS. That's why I try to educate my community. Don't get surprised, don't get scared about the number, because they have so many cases of people with the CD4 below 200 start taking the medication, and they have the CD4 count over 1,000 or 800, and they can live healthy, better life.
So you mentioned that education is an important component. What are the ways in which we can create safe pathways and/or an environment or services so that more of the Latino community knows where to go for information and where to go for support, where to go for services?
Prevention. Our program, EPIC, they have really good prevention program. And also, church could be a good tool to promote healthy relationships, because ironically, many people see faith as a scope to do better. They see faith and hope like a quality of life, encourage me to do better. And many of the practices in church encourage, like, don't drink, don't smoke, no sex, outside your marriage. And they can promote like healthy lifestyle for many patients. Also, educate the community and like I say, sometimes it's who you know, because you can connect with so and so. I can provide better service for the community. Something similar with Latino and African American community, grandma. Whatever grandma say, in many cases, I have to talk with grandma without, be carefully with HIPAA violation. And many kids, listen to whatever grandma say, and maybe they encourage them to start medication. If she knows the status, we can talk. It's not private.
So I'm hearing you say education is important. I'm hearing you say working with institutions like the church are helping to build healthy, positive behaviors and environments. I'm also hearing you say our relationships, grandmas, and the people in our lives whose advice we value and care is important to build that. What is the message that our churches, our grandmas, and these prevention programs should be promoting?
Oh, good. Let me answer the question, but I forgot something to say about many of the HIV cases patients, they feel alone. Like they don't have no support. And those base community, faith or base community, we can let them know we don't exclude, we include people to the community. You're part of the community, you're important, Sometimes use some example, like diabetes and HIV. It's kind of funny, but I don't want to have any, but people are more worried about HIV. I try to educate my client. If you got the big picture, HIV is more easy to manage than diabetes because HIV is a virus from outside. As long as you take your medication, you have the virus under control. But diabetes can damage your pancreas, liver, heart, eyes, and it's more complicated. In many of the clients, oh, you're right, you make sense. And they start not only taking care about HIV, start taking care of other medical issues or concerns.
I love what you're saying. So I'm hearing you say you're not alone, right? If you're someone who has contracted the HIV virus, there's a community that's out there to support you, and there are services available to help you live with this, right?
Sure. Let me AIDA create a program, now with the marketplace. For instance, Biktarvy, one of the HIV medications, costs around $3,000. And people who working and without insurance, they can apply for marketplace. And now, because the insurance costs less money, AIDA is willing to pay the health insurance. Now, they only receive medical attention for HIV, but they can go to different specialists because AIDA or Pinellas Care Clinic only cover HIV situation. But with health insurance, people can go to different specialists. And now with the pandemic, with the COVID-19, the government decided to open the marketplace. I see like 3 or 4 Latino clients that was willing to enroll, and they're more than happy because now they only have HIV medication. Now they have insurance, they can go to different specialists according to their needs.
Wow, okay, so now we're hearing a little bit about what can happen in the community, right? The community can help us remember, destigmatize AIDS, destigmatize HIV. This is something we can be in community with. Abuela ayuda, la iglesia ayuda, the community can help. Now you started to bring in some other systems that can support, which is healthcare, and then also maybe let's talk about the medical system or the medical world. How and in what ways can doctors, nurses, support, or what are some of the issues there in our community that are barriers to lowering the number of cases?
Yeah, one of the strategies that the state and local health department is doing right now is to have medical access to patients with HIV. In my case, for instance, any new case, I had to complete the eligibility, and in the eligibility, I can refer the client to Pinellas Care Clinic. After I refer the client to Pinellas Care Clinic, they can go to AIDA, and AIDA covers the medication. I try to educate my client. You have to complete every 6 months with us and with AIDA, and as long as you keep doing great, AIDA is willing to pay the medication. And in many cases, the state noticed that it's way better to cover the HIV medication than ignore the pandemic, because it's way more, basically, they saving more money paying the HIV medication because it's federal program. Doesn't matter, you immigration status, you can apply for the benefit and you can have a quality life of life.
So let's say you have una varita mágica, a little magic wand, and you get to solve for HIV and AIDS in the Latino community. ¿Qué haría tu varita mágica? What would your little magic wand do to help address, lower the number of cases and
Well, yeah, good question. The first thing I can do is an assessment because HIV is a little bit different than other medical complications because HIV could be a social issue or could be a medical issue. Many of the people ended up with some people ended up with HIV due to the social issues. Some barriers they had in the houses that they don't want to keep time in the house, let me go outside. And for some people, HIV could be a medical issue. My first thing is to create an assessment, evaluation, what is the major need that he needs, and according to that assessment, I can create a plan of care and keep going according to their needs.
Mm-hmm. Great. So who is most at risk in our community? Who is most at risk?
I always compare Latino population like a tree with different branches. We are the branches. And it's kind of complex because every Latino has different ethnicity, has different priority. For instance, let me give you an example. In case of Puerto Rico, the majority is like IDU. When you're using IDU, if you are married, you might infect your wife. That's why a lot of cases, but if I'm not mistaken, the majority of female are from Puerto Rico because IDU is a concern. And when you're doing IDU, you can do anything to have drugs. And they're more than willing to have a really high risk. And also when you start using IDU, injected drug use, you might have a late AIDS diagnosis. In the case of South America, it's completely different. The majority MSM came from different countries, and they left the family in their country, depression. And one substitute depression is cheaper than medication is alcohol. And when you're drinking alcohol, you can negotiate about having sex practice, you know. It's kind of complicated, you have to identify. However, you know, it's a lot of work. My concern is the percentage of AIDS among the Latino community is high. And like I said at the beginning, people start moving to South. And now, even though Georgia is #1 in HIV cases, but we have more HIV population in Florida than in Georgia, meaning that we have a lot of work to do. Mm-hmm. And I was talking to you before about the triangle in Florida, Orlando, Tampa, and Miami. And for some reason, people go to Miami for lifestyle and came back. Like I said before, the HIV is not a bird moving around. You carry the virus with you, and people might get affected. It was something interesting. I was working with the health department in Orlando. People go to Miami, and they know the risk area in Miami because they go to party, and even the younger population because it's another issue. Now, because we have better medication, people live longer. And because people live longer, it's another risk. And if you're not taking the medication properly, you can infect other individuals.
So I heard a couple of things in what you said. Folks are getting infected because they're not safely engaging in sexual activities. There's no safe sex conversation. So I want you to talk to me about what are some of the barriers and some of the educational opportunities to address safe sex in the Latino community.
Okay, even my personal situation, you know, Latino is the taboo about sex. I grew up, I never remember my mom talking about sex. I learned sex from others, unfortunately, you know. And even though in church, people are afraid to talk about sex. People talk about, even though el machismo is a lot of, similar to Black community, is down low, and because sometimes Latino church tend to be a little bit more judgmental, they prefer to stay quiet and doesn't expose sexual preference. And this is an issue that we have to educate, how to communicate. Also, the vocabulary we use in church. For some reason, some Latinos like to love apocalyptic event, and many in church see the HIV/AIDS like a punish from God or the signal from the end of the world. And as a Latino, we have to communicate. It's more than that. God loves everyone, and God never include people to work together. Always, this is my personal philosophy, if I have to say like that. Never forget where I came from. Never forget, never burn the bridge. People, when you was alone, people help you out. I came to the United States at the age 19. I was alone, but people helped me out. And something that I learned from my family always work with the community. Never forget who you're from. Never forget help others. If you at least help others, people might willing to help also, people might. But my job as a medical case manager is provide hope, optimism that we can do better. And also I have to educate my Latino population that they made a study that people with HIV and people without HIV and life expectancy is about the same, like maybe 2 or 3 years different. I used to have clients, with over 80-something years old, and they was in better shape than I'm not gonna lie to you, because they was taking the medication. So people without blood pressure, without the only medical concern is HIV. As long as you take your medication daily, you're gonna be fine. I try to promote clients. Remember, before at the beginning it was like 18, 20 pills per day. Now with one pill, you can live fine.
I heard some really good news, Galo. So you said that you have clients that the life expectancy of someone with HIV and without HIV is about the same.
Yeah, it's about maybe 2-3 years different.
Yeah, and so there are some of your clients who are HIV positive that are in better shape than you and I together, right?
Yeah.
So it's a couple of things I heard that I think are important to make sure that we remember, right? When we're talking about safe sex in the Latino community, how we talk about it in the community will be important, right? Getting the language, the access to the right information, the education you mentioned is also important. And remembering that culture and community are one when we are addressing this issue, right? We need to work together is something that I heard you say I think is really, really important when we're talking about solutions. So think of this like ending, the world where we want it to be. And I would love for you to be able to do this in English and Spanish, because I think this is very powerful. What is your message, right? When you're thinking and talking to the community directly, all of us here in the world that are not thinking about the little bird of HIV, but all of us who may be carrying it or may be at risk because of safe sex, drugs, or even feeling lonely, right? What is your message to your community?
My message is simple: education. Fernando Martin, one of the major person in Cuba, he said, "Sé culto para ser libre." You can translate that, and education is the key. I noticed, I witnessed the people who the CD4 is so low, get educated, and now they are working. They're fully happy. They get married. They have family, because they decide, don't blame others, take responsibility, get medical attention, Like I always compare our body like a car. Sometimes I try to educate my client. Your body is like a car. If your body says some signal, if something going on, try to get medical attention, educate yourself, pay attention a little detail, and you're gonna see the difference. Because you're gonna mark not only the difference to you, but to the rest of the family. One of my achievements that I have to say is like, see people, for instance, I had a case like his CD4 was 4. He was like a walking dead. Now he's working. Now he's an example. He can live better, stop drinking. It's a really lifestyle like normal people. Even though I was thinking to use to talk about HIV in the Latino community, that you was in bad condition, but you get healthy and you can promote those similar lifestyle to others in need like you was before.
Beautiful. Sé culto para ser libre. Hold integrity so that you can be free. Educate yourself, pay attention to your community, and seek help when you need it. Thank you so much, Galo. Really appreciate your time.